It's Doug from Topical Steroid Addiction, and today I'm going to be talking about the potential side effects of using steroid creams. So I've printed this off from the National Eczema Society. It's a fact sheet that they have available, and I'm going to be reading off of that. Topical steroid potencies. In the UK, topical steroid preparations are divided into 4 categories according to how strong or potent they are. The terms are mild, moderately potent, potent, and very potent. The potency of topical steroids is determined by the amount of vasoconstriction, narrowing of the blood vessels, they produce. It also relates to the degree to which the topical steroid inhibits inflammation and its potential for causing side effects. So, what are the side effects of using steroid creams? Now, this is a steroid cream that I got. I won't show you which one it is because I don't want to get sued by anybody. But this is basically just a steroid cream that I got over the counter a couple of days ago, just so that I could get out the side effects. So this isn't something that you need a doctor or a dermatologist for. This is something if you were to go into a local pharmacy and ask for a steroid cream, this is what they would give you. Now let's look at the potential side effects. So, section number 4, possible side effects. Like all medicines, this steroid cream can have side effects, but not everybody gets them. Stop using this product and consult your doctor if you see any of the following side effects. Very rare, affects less in 1 in 10,000 people. Redness of the skin, itching, hives, local skin burning, increased hair growth, changes in skin colour, skin thinning. You may also find that your symptoms get worse while using the cream. Tell your doctor if this happens. Also, if you were to Google something like steroid cream side effects, you'd also get other things like nausea come up. And headaches. The reason why you would get that is because headaches are vascular. Again, it's a blood vessel problem. So that's just the information I've got off the National Eczema Society fact sheet, and just the slip that came with the steroid cream I got over the counter. So, what is this saying? This is saying that drugs have side effects, and if you have side effects, you should report them to a doctor or your pharmacy or a dermatologist. The trouble is, when you do that, they say it's the underlying skin rash getting worse. It's bad eczema. It's chronic eczema. It's worsening eczema. I don't know how many times I'm going to do this. These are 2 little rabbits I've got talking to each other. The trouble is, they believe that it's the underlying rash getting worse for no reason whatsoever, other than the fact that you've got dry skin and you're not looking after your skin and moisturising it properly. That's their argument. That's what they're saying is the reason for this spreading rash going all over the body, destroying your life. Not only do you have these side effects, as a result of the constant itching and the burning, you also have insomnia. You have digestive problems, you have behaviour problems, you have a whole range of other effects. This totally takes over your life. But it's just bad eczema. But is it? Is it just bad eczema? Is it just a little bit of dry skin? Or are these patients experiencing the side effects of using these steroid creams? So you have to kind of make a decision. Is it just that the skin's getting worse because of the lack of moisturiser and So-Conceal that's being used and it's just a bit of dry skin? Or is the skin getting really, really bad and intolerable and unlivable and spreading and getting worse because of the use and the side effect of topical steroid creams? Now, having said all this, originally there probably was a small patch of eczema. You probably had a bit of dry skin. So, in theory, they are right. it is eczema because that was the original diagnosis. But they're also wrong because the reason why they're having ongoing problems, the reasoning why they're having worsening symptoms is because of the side effects. And they even tell you that in the packet when you buy the cream. And when you report it to the doctors, they continue to misdiagnose it, calling it worsening or bad or chronic eczema instead of calling it by its correct title, which is red skin syndrome. Why is it called red skin syndrome? Because steroid creams constrict blood vessels, and then because blood vessels open up again, they vasodilate and they go red. And they burn and they itch and they ooze. My intention in this video is not to cause steroid phobia. My intention in this video is to convey to you that whether you're going to a pharmacy or to a doctor or a dermatologist and you're using a steroid cream from either one of those places, whether it's prescribed or over the counter, that you just take caution and you monitor what's happening to your child or to yourself in the skin. Is the skin getting worse over time, or is it getting better over time? Do you rely on the steroid cream, or do you not need the steroid cream in your life? You just need to bonk it on the head. And because it is a misdiagnosis, this is another problem where it's going, because you did have eczema originally, and then you applied the steroid creams, and it went away, ta-da, and then it came back again, and it came back again worse. They think, well, yeah, but that's the eczema getting worse. But it's not. The reason why it's getting worse and worse and worse and worse each time is because of the constant reapplication of steroid cream. Drugs have side effects, and sometimes people experience side effects of those medications, and therefore they need to cease using those medications. To me, it's a very simple, straightforward idea. But there's all sorts of beliefs that it's to do with diet, or the skin's infected, or there's various other things that distract as to why the eczema is getting worse all the time. But really, it's just a result of the medication. So if you stop the medication, they'll get better. Also, the National Eczema Society says, we help, we listen, we understand. Well, I am listening, I do understand, and I am trying to help with these videos. So if you do have any questions or comments or any ideas for future videos, please let me know and I'll do my best to accommodate. Thank you very much for watching this video. I hope you found it helpful. Now I'm going to bounce. This video is not intended as medical advice. If you'd like more information on topical steroid addiction, please visit redskinssyndrome.com. If you'd like to see more of these videos, subscribe now. Also, if you're watching this on Facebook, please like and share the information.